Services across Worcestershire are not safe, a panel of experts has concluded. Changes to children's services also need a lot more work, according to a report by the West Midlands Clinical Senate. Doctors across Redditch and Bromsgrove are meeting this afternoon and are demanding other options. I'm joined now by our health correspondent, Michele Paduano. Michele, what's the problem with emergency services?
Just to recap first, this was the report that we weren't allowed to see before the general election, and this was the reason behind which the doctors at the Alexandra Hospital actually resigned back in February. But the big problem is to do with, if you take away emergency surgery from the trust, then the junior doctors that come in and train at the hospital can't train there. And the argument is that if they don't train there, the services won't be safe. Now, the hospital had an idea of bringing in nurse practitioners to take their place. That won't work. And what's going to happen now is that the plan that has been in place for 4 years, they've been trying to work up, basically isn't working. They need to find a plan B.
Now, I understand there are also issues around children's services at the Alexandra Hospital as well.
Yes, there are. The plan, they accept the plan to move children's services to Worcester from Redditch is a good one, but they say they're not convinced that Worcester has enough capacity to do it. Now, Worcester's talked about moving people through the beds more quickly. They say more work needs to be done about that. But they're also confused about whether or not mums will really know where to go, where to take their children, and that could lead to safety issues. And so they say that a lot more work needs to be done before that takes place.
So we've got this meeting today. What's taking place there?
Well, doctors from Redditch and Bromsgrove are meeting together, and they're thinking the unthinkable, which is actually the breakup of the Worcestershire Acute Trust. They're talking about looking towards Birmingham, towards the Birmingham University Hospital Birmingham and the Women's Hospital, to try and source their services from there and to actually destroy the trust as it is. Now, that could have cataclysmic consequences for Worcester. Now, the people who've been putting together the plan are still putting a brave face on this, and they're saying that they're taking on board what's been said and they're looking to move towards a consultation later this year.
Okay, thanks for your time.